Shatadeepa Goswami, uh, a senior clinical associate at Apollo Hospitals, Mumbai. That is obviously my technical designation, but I think my actual designation is that I'm a mom to two kids. Uh, so 8 years of clinical experience, almost 6 years of maternal experience. I'm sure now you must have understood my practical experience has been a good number of years. So I am extremely thankful to BabyChakra for having given me this opportunity to speak on a topic which is very important, a kind of a burning topic in our schools, daycares, and playgroup settings. And I think the technical or the theoretical aspects, most of us have read it up either on the internet and a lot of articles have been written on the newspapers and everything. So I don't want to touch up much on the theoretical aspect. Basically, it's the practical things, the practical care that we need to do for the kids that I'm going to focus on my in my talk today. So as a pediatrician, I think getting a child to laugh is one of the most rewarding experiences I've had in the clinic. And but this season, unfortunately, hasn't gone too well with the kids. 2 years of pandemic, everybody was at home. Kids were taken. Kids were happy. Did not go into out into the community, so they were not much uh, they were not getting much of infections or diseases or anything else. Come 2020, bang, with a bang, everybody started going to schools, play groups, tuitions. People started moving out of their houses for vacations, and this season became a daunting season for parents when kids started getting all these community acquired infections, out of which I think the hand, foot, mouth disease has been so rampant and my topic of discussion today. So, just quickly going through a few points of hand, foot, mouth disease before we discuss the practical thing. Uh, it is a self limiting viral disease. So, the very terminology self limiting means that it starts on its own, it has its own course of action, and then it goes away on its own, generally not leaving behind any complications or scar marks. It is caused by various viruses, but the three most common viruses doing the rounds in our Indian community settings in this season is Coxsackie virus A616 and enterovirus 71. Now, why I'm discussing this technical aspect with you, which you may just feel that is absolutely unnecessary, I will touch upon this point that why I'm discussing that there are three different viruses doing the rounds in this season. Now, incubation period, generally when the child is coming in contact, how does the disease spread? Earlier we used to think that it is only through the fluids, the blisters के जो fluids होते हैं वो जब contact में आते हैं दूसरे बच्चों के साथ, that is how it spreads. But right now इस season को नजर रखते हुए there are three modes of spread that we have actually seen. First is obviously through the fluid of the blister. So basically you're coming in contact with a child who is suffering from the hand, foot, mouth disease. Second mode is किसी बच्चे ने एक surface छुआ है, that surface has, the infected child has touched any surface, so वो surface infect हो जाता है, and then the next child comes and touches the same surface. So that is one mode. And the third and the most a bit of a scary mode of transmission is the respiratory droplets. That means it is spreading also through the air. That is the recent mode of transmission that we have seen in the setting today. What is the age group that it is affecting? Books and theories mention it is generally up to 5 to 7 years of age. Yes, I agree. In this season, most of my cases, almost 80% of the kids that I have seen are up to the age of 6 to 7 years. But we have also seen kids come in the age group of 9, 10, 11, 12. The maximum age range where I have seen hand, foot, mouth disease occurring, that was only one case, which was around 23-year-old, but that was very rare. That was just one case. But in the teenage age group of 12, 13, we have seen around 5% cases. But the maximum chunk of cases, it is in the first 7 years of life. So suddenly after the child gets the infection, एक incubation period होता है which is very short, in just like a viral infection, 2 to 5 days incubation period होता है. उसके बाद suddenly the child will come down with a fever, mild to moderate grade fever, 99, 100, max 101. The child has a general feeling of not feeling well. The child is not eating, the child is listless, lethargic, जैसे typical viral में होता है. बच्चा बोल रहा है, हेडेक हो रहा है, बदन दर्द कर रहा है, just wants to lie down. हल्की सी सर्दी भी हो सकती है along with that. So these symptoms are there for around 36-48 hours. And suddenly, what is peculiar of this disease is suddenly you will see a defervescence of the fever. Defervescence मतलब fever चला जाता है. Fever चले जाने के बाद फिर ये typical rashes आने चालू हो जाते हैं. And also I'm going to tell you why I'm discussing this point कि fever चला जाता है और उसके बाद rash आ रहा है, because that is how also we detect and differentiate it from some other infections, which I'm just coming to. So जब ये rashes आ जाते हैं, as the name suggests, hand, foot, mouth. So there is this typical, तो हाथों के तलवे पे, here, the foot. Then we have also the knees, घुटनों पे, elbows पे. A very common place of distribution हमने देखा है, that is the buttocks. The lower buttocks के जो creases होते हैं, the lower buttock fold, उस पे काफी बच्चों को हुआ है. And the mouth. Now, how do these rashes begin and how do they look like? How do they progress? The rashes begin like blisters. Then they slowly start becoming fluid filled. आपको पानी भरे हुए rashes लगेंगे. And suddenly they start appearing like हमारे पास काफी parents आए, मैम हमारे बच्चे को चिकन पॉक्स हुआ है. And then I explained to them that how different it is from chicken pox. सो फ्लूइड फिल्ड हो जाते हैं. उसके बाद धीरे धीरे दे गो थ्रू दिस एजेस, दे बिकम वेरी इची. देन दे स्टार्ट, ऊपर से आप देखोगे थोड़ा सा स्कैबिंग हो जाता है, जहाँ पे ड्राइंग आपको दिखेगा सूखने लगा है, एंड फिर वो सूख के स्कैब्स गिर जाते हैं. That's the typical progress of the rashes. But what is difficult in these rashes is that the rashes initially are painful and then basically they become very itchy. The child is very jittery. The child keeps itching, can't sleep through the night. The buttocks are itchy. It's a general tendency of irritability throughout for the child. So what, and then the mouth lesions are the mainly difficult ones, because that causes white छोटे छोटे दाने आ जाते हैं, या फिर they start looking like red ulcers inside the mouth. And that is the most difficult part, because then the child stops eating. The child cannot eat. It's very painful phenomenon. Typically lips पे आते हैं, tongues पे आते हैं, और तालू पे, जो palate बोलते हैं हमें, it's there where we get the rashes. So how can I prevent hand, foot, and mouth disease in my 8-year-old child? So, as I told you, 7 to 8 year olds, it's so the first and foremost is when you see a child or your child suffering from hand, foot, mouth disease, please do not send the child to school or down to play. Please keep the child isolated at home at least for 5 to 7 days till you see the scabs drying and falling away. Second is when your child is particularly a season, because also it is spreading through touching of infected surfaces, please see to it that you're regularly sanitizing your hands. Particularly बच्चे जब खेलने से वापस आ रहे हैं, please sanitize, wash hands regularly, sanitize the child's hands. Now the third mode of transmission, as I told you, the respiratory, it's very difficult for me to tell you कि घर में भी खेलने पे भी mask लगा, which should be ideal. Ideal situation is the child should be wearing masks wherever the child is going, which sometimes is not possible in the setting. So my most important point for preventing this would be, if parents are a bit more vigilant, and even a single blister if they see anywhere on the body or in the mouth, please isolate that child at home. Do not let the child go to your playgroup, school, or wherever, tuitions, anywhere. Now, how we detect this disease, the detection does not require any complicated blood tests, x-rays, kuch bhi nahi lagta hai. It is the typical history when the mothers gave ki fever hua hai, fever chala gaya, aur uske baad rashes aa gaya, and the typical distribution of the rash. That is how we detect hand, foot, and mouth disease. Now, treatment, that's the most important part of my discussion today. Because it is a viral disease, it does not require any antibiotic, it does not have any drug of choice. Whatever treatment we do, the treatment is basically a symptomatic treatment. In medical terms, we call it symptomatic treatment. So I discuss treatment under three heads. One is a general treatment. Next is what do I do for the skin rashes. The next I tell what do we do for the throat lesions, the throat के जो ulcers हैं, mouth के जो ulcers हैं. So first is general. General में I always tell the patients, please give bath to the child. Many parents I have seen that they stop giving bath to their child कि नहीं blister आया है, blister फूट जाएगा, तकलीफ होगा blisters पे. But please, no, please give your child a bath. This bath, if possible even twice, I do not mind, but at least once daily bath is essential, and with a neem based soap. अर्लियर के ज़माने में हम जब चिकन पॉक्स या फिर कोई रैश जैसी बीमारी होती थी, हम नीम के पत्ते बॉयल करके used to give a bath to the patient. So the same way now there are various neem based soaps in the market. So give your child bath with a neem based soap. जब धूप दिखे, please put the child, expose the child's blisters, the rashes, the body rashes to the sun. So that actually helps to dry up the lesions faster, kill the viruses faster. So these are the two general treatments. Now coming to the skin rashes, how do I treat the skin rashes? To to give the child relief from a general itchiness, we say a dermocalm, a lactocalamine lotion, local application over the body wherever there are rashes. That chin, it gives a lot of soothing effect to the child. You can apply twice, thrice even, particularly before bedtime, then the child can actually sleep. If the rashes are too itchy, then we can also start with a anti-allergic medication twice a day. So that will also help to keep the rashes at bay. The child doesn't feel very itchy. The child can have a good sleep. Now, next are my throat, my mouth ulcers. So, a local gel, there are various painkiller gels available in the market, which even if you swallow, there shouldn't be. So, what they do is basically you can just apply it in the on the lips, on the tongue, wherever you can see. And if the ulcers or the lesions are very deep inside, what you can do is you can just apply it on the tongue. So, what happens when you apply it on the tongue? When the child swallows the gel, it basically coats the palate and also the throat inside. So, it gives a lot of soothing effect to the child. Basically, I suggest to apply this gel every time 15 to 20 minutes before eating your breakfast, lunch, evening snacks and dinner. So, 4 बार दिन में लगाइएगा. So, उससे क्या होता है, बच्चे को आराम पड़ता है, कुछ बच्चा खा पाता है. इफ इट इज वेरी पेनफुल कि जेल लगाने के बाद भी ऐसे भी दर्द हो रहा है, हम 2 से 3 दिन के लिए एनी ओरल पेन किलर्स लाइक अ पैरासीटामोल, जैसे वी एडल्ट्स वी कैन टेक पैरासीटामोल फॉर हेडेक, सेम वे वी कैन ऑल्सो टेक पैरासीटामोल. वी कैन गिव द चाइल्ड अ सिरप पैरासीटामोल 8 hourly दिन में, एक 2 से 3 दिन के लिए, to keep generally the pain at bay. In this case, we are not giving paracetamol for the fever because एक बार rash आ जाता है तो fever चला गया है. So right now we are giving paracetamol to basically keep the throat pain under control. Now parents first ask me, what do I feed my child? मेरे बच्चे ने सब कुछ खाना बंद कर दिया. Very difficult problem. I have a kid. I know how difficult and how distressing it is for the parent when the child even starts rejecting water. I have had children who have started rejecting water. They can't even swallow their own saliva. They're drooling saliva in the clinic. So in such cases, I always say, give something cold. क्योंकि बहुत एनीथिंग वेरी सॉल्टी, एनीथिंग वेरी स्पाइसी जिसमें बहुत नमक डलता है, गरम गार्गलिंग जैसे गरम पानी में, तो बहुत जलेगा. इट रियली इट्स वेरी पेनफुल फॉर द चाइल्ड. सो एनीथिंग विच इज कोल्ड, फ्लूइड्स, पानी देना है थोड़ा सा ठंडा दे दीजिए पानी. योगर्ट्स, कर्ड्स, घर पे बने हुए जो दही होते हैं, आप बाहर से भी ला सकते हैं. कोल्ड योगर्ट्स, कोल्ड दही, शेक्स, मिल्क शेक्स दे दीजिए. बच्चा ऐसे बनाना नहीं खा रहा है तो बनाना को मिल्क में डाल के बनाना मिल्क शेक बना के दे दीजिए, तो वो ठंडा होता है. बच्चे में कैलोरीज भी गई, कुछ खिला भी पाए बच्चे को. व्हाट वी हैव टू डू इज कीप एटलीस्ट द चाइल्ड हाइड्रेटेड. थोड़ा सा सॉलिड अगर 1-2 दिन कम खा लिया प्रॉब्लम नहीं है, बट द हाइड्रेशन शुड बी देयर. Now, parents have asked me, what are the danger signs of this disease that needs any emergency attention? Basically, the disease per se does not cause any complications or any danger signs. What happens is, at least हमने कोई complication या बहुत dangerous, what happens is, the major complication of this disease is बच्चा खाता नहीं है, और बच्चा नहीं खाया तो डिहाइड्रेटेड हो जाता है, एंड डिहाइड्रेशन की वजह से वी हैव एडमिटेड चिल्ड्रन इन माय hospital, and we have had to push IV fluids, and we have not given any antibiotics still, just IV fluids. That is the only complication of hand foot mouth disease that we've seen in a healthy child. So I always tell parents, please try and give your child as much fluids as possible. Parents have asked me, ma'am, हमने ठंडा दे दिया तो बच्चे को सर्दी तो नहीं हो जाएगी? But I sometimes say you also have to weigh the risk versus the benefit. सर्दी हो जाएगी, हम मैनेज कर लेंगे सर्दी की दवाई लेके, पर बच्चे ने एकदम खाना बंद कर दिया, डिहाइड्रेटेड हो गया, so that is a much more difficult problem to handle. So right now let's manage the hydration of the child. सर्दी होगी तो वो मैनेज हो जाएगा, फिलहाल let's manage the nutrition and the hydration of the child. So again, the same question I can see on my screen is, do you need hospitalization? The hospitalization, again, not for the illness per se, but for the dehydration that follows the illness. Now, when I say that generally there are no complications of this disease, there are very few remote complications of this disease that textbooks mention. But thankfully, in this season, I haven't treated a single one of those complications we have not seen. They say it happens because of some meningitis or something may happen to the child, but I am sure that happens to very weak, debilitated kids with chronic diseases. But for a healthy child, I don't think it will cause any complications. Now, I want to one more very prominent question that patients ask me, कि मैम ये scar marks चले जाएंगे ना? I say yes, the scar marks will go. The scar marks may take some time, 3-4 months, but they go away, they do not stay. One more practical point: tomato flu, chickenpox, hand foot mouth disease. How do I differentiate between the two? Now, tomato flu is again a variant of hand foot mouth disease only. The only difference is the blisters are larger, but again, it is a self limiting disease. The same treatment goes for hand foot mouth disease, the same for tomato flu. So basically, tomato flu, it is a variant of hand foot mouth disease, only that the blister size are longer, larger. Now, what is about chickenpox? So, as I was discussing why chickenpox, we were discussing that kabhi the rashes look very similar to chickenpox. So, chickenpox, typically distribution is not the hand, foot, mouth, buttocks, elbows. Mainly, it is the central body which is involved. And with fever आता है, fever के peak पे rashes आते हैं, rashes die down हो जाते हैं. फिर से fever आता है, one crop of lesions appear there. So every time with one bout of fever, you will see a fresh crop of lesions. This is not what happens in hand foot mouth disease. Fever आके पूरा निकल जाता है, उसके बाद वो rashes आते हैं. That is the basic difference between chickenpox and hand foot mouth disease. So I suddenly got a question on my screen. My kid had blisters on his hand. How can I prevent the spread of blisters to the other parts of the body in my kids? I'm so sorry, but then unfortunately, I cannot spread the infection. Once the infection starts, I cannot really spread the infection from my hand or from my foot to the knees or elbows. It generally, the progression once started has started. You can't do much about spreading the infections to the other parts of the body. Now, also another question that I get is, once the child recovers from hand foot mouth disease, what do I do after recovery? Very important questions. तो faster recovery के लिए हम एक multivitamin B complex multivitamin tonic दे देते हैं बच्चों को for 15 to 20 days or even a month. So what that B complex medicine does is it helps to heal the rashes faster and ulcers faster, and then it also helps in the general well-being and building up of the immunity of the child. So I think I could cover some of the things about hand foot mouth disease and some queries and questions that you must have all had in this season. So my only takeaway message from this talk would be that it is a self-limiting viral disease. Do not worry. Please keep your child at home once you see these lesions appearing. If you have two siblings at home, be sure that you're isolating one sibling from the other. Difficult task, I know, but please, it is important because then it is the contact which makes the majority effect, and it only requires symptomatic treatment. Please hydrate your kids. The oral intake is the only thing that we doctors are worried about. Otherwise, nothing else is as much worrying as that for us. So thank you, everybody. It was nice meeting on a Sunday morning, discussing on a topic, and I hope I could um, and help you solve some of your doubts. And if anything else, you can absolutely let me know. I thank once again BabyChakra for giving me this lovely platform where I could connect with parents. And nice to